Yeah, you gotta be in the frame. Like,
Oh, sorry.
yeah,
I just got out of the shower, so
that's fine.
And I need a shower, so.
Okay, great. Great. Okay. Okay, so we're good to get started.
Do I have to stay in the frame the whole time?
Yeah.
Okay, all right.
Well, when we think of supplements, we think of athletes taking protein powders and creatines, people with vitamin deficiencies taking iron supplements, or people looking for alternative medicines. What we don't think of is the supplement industry and manufacturers who have been taking advantage of outdated laws and putting people's lives at risk. I believe that we as consumers shouldn't take advantage of for industry gain. Now you might be thinking to yourself, who cares? Well, 76% of US adults surveyed by the CRN 2017 Consumer Survey on Dietary Supplements would agree that they care. And in this speech, we'll be covering the history of supplements, some of the current day problems, and things we can do about the situation. Now, in the early 1900s, doctors could sell whatever they wanted and call it medicine. Often it was ineffective and sometimes contained mercury or arsenic, according to Joseph Strongberg of the Smithsonian Magazine. They were essentially selling snake oil. And as a result, Congress passed the Food and Drugs Act in 1906. It set some framework of the FDA, but according to their own website, it did little to stop many hazardous consumer items from remaining on the market. These products included Lash Lure, a product designed to dye women's eyelashes. It ended up causing eye injuries and in one case blindness, along with Elixir sulfanilamide, which was marketed to pediatric patients and made of a highly toxic analog to antifreeze. It killed over 100 people, including children. Now, it forced Congress to pass the Federal Food, Drug, and Cosmetic Act of 1938. It worked to give the FDA some more power it was lacking and added some new authority to the agency. In later years, the FDA would call for greater regulation of supplements. The industry will use celebrities to encourage the public to stop this based on a false narrative they created, along with lobbying senators. For example, Orrin Hatch and Tom Harkin, who will later go on to create DESHA in 1994. For perspective, according to Examining the Science Behind Nutraceuticals, there were more letters drafted that were sent to the government saying we want dietary supplement products to stay available than on any other issue aside from the Vietnam War. All of this led to the Dietary Supplement Health and Education Act, otherwise known as DESHA, being created in 1994. It created some labeling requirements and frameworks for good practices and regulations. Now, it failed in requiring manufacturers to get FDA approval before marketing. They don't have to prove efficacy or safety of their products, and they can make health claims without any prior approval from the government. Now, researchers Ashke Kapoor and Joshua Sharfstein published Breaking the Gridlock, Regulation of Dietary Supplements in the United States, and found that in the first 3 months of 2015, 30 different sexual enhancement products and fat burners with ingredients that had previously been withdrawn from the US market. They also found cases of protein powders containing steroids, cases of products being recalled that had still been available, cases of products being recalled and later being found available on the market, 2/3 of which contained banned ingredients. Anna O'Connor of the New York Times reported in 2013 that for an estimated 15,000 manufacturers of supplements, the FDA can only conduct 400 inspections a year. 2/3 of those tested fail, and most for multiple infractions. Now, they also reported that a Canadian researcher used DNA barcoding to test 44 products from 12 different companies. These products were mostly herbal supplements, but they found In some cases, cheap fillers were being used for the plants advertised. For example, rice powders or wheat. A third of the products showed outright substitution, where no trace of the product advertised was found. And in some cases, the filler turned out to be laxatives. Now this leads us to ephedra. It's naturally occurring and comes from the plant, which I believe is pronounced mahuan. It contains ephedrine and pseudoephedrine, both stimulants that constrict blood vessels. Now, according to the Harvard Health website, the supplement has been conclusively linked to cases of healthy adults suddenly falling ill or even dying after taking it. It was used for years as a fat burner in supplements. There were 16,000 reports of adverse health effects and 155 deaths before it was finally banned in 2004. Now, I bet you're wondering, supplements are supposed to help us, right? Well, the short answer is yes. And Senators Orrin Hatch and Tom Harkin are two people that would disagree with a lot of the points I've made. They're also two of the biggest proponents of the supplement industry and the guys that created the Dietary Supplement Health and Education Act. I mentioned them earlier. Now, Hatch has been quoted saying that the FDA already has a tremendous amount of regulatory oversight and enforcement tools when it comes to dietary supplements. Harkin has said every supplement has a label, has the ingredients, has the potency by law in every single supplement. Now, do y'all want to guess who supplement lobbyists were sending the most money to? Orrin Hatch and Tom Harkin. Now, I'd also like to point out where they're wrong. We know based on evidence that the FDA has power to stop things only after they've already happened. Sometimes it takes years before they can officially ban a product, and it could still end up on the market. Now, as for Harkin's point, there are scientific studies that prove what's in the bottle isn't always what's on the label. Now, what can we do about it? Well, it's easy. You can do your homework before buying whatever supplement it is at the store. You can look for products that are NSF, USP, or Informed Choice approved. They perform rigorous testing, and the NSF is where NCAA athletes go to find trusted supplements. We as consumers have a lot of power. We can choose to buy from manufacturers that are willing to undergo the testing needed to prove that their product is safe. If you want to learn more, there are plenty of resources online and a couple of really easy to digest videos on YouTube from Adam Ruins Everything and Last Week Tonight with John Oliver. Now in closing, we've covered a lot, from supplement history to some current day problems with the industry to some other people's opinions and even things that we can do about the situation. Now I believe supplement manufacturers have been taking advantage of outdated laws and putting people's lives at risk. We shouldn't have to live in a world where the regulatory agency designed to protect us can't unless something terrible happens first. Supplements are supposed to help us. Supplement manufacturers aren't looking out for our best interest, and it's time that they should. Thank you. All right. Thanks, guys.
Thanks, Mac.
It's great.
Thank you
Bye,
guys.
everybody.
See you guys. Hey, John. Good to see y'all.
Good night. Night,
night.
everyone.
Good night, guys. Thank you.
Okay.